Hello and welcome. My name is James Fitzgerald. I'm a board-certified Vermont state licensed clinical mental health counselor. This video is meant to be viewed by existing clients, new clients, and potential clients. It is not meant to replace professional mental health support or care. This video is the first in a broader series of videos. Today, I'd like to take you through a comprehensive overview of my therapy program and universal treatment plan that I use with my clients. In this first video of the series, we'll be looking at your long-term goals for therapy. But first, let me say a few things about the way I present the information in the videos. I will be speaking from the perspective of a professional mental health counselor directly addressing you, the viewer. I have created a separate video for professionals who might be interested in this program. My therapy program is designed to provide a holistic and integrative approach to individual mental health and wellness, ensuring that every aspect of making changes in every domain of your life is supported and nurtured. A supporting document accompanies this video. I will create a copy of that document that details this program and place it in your treatment plan to be made an important piece of the official treatment plan document in your clinical chart. Stored in Therapy Notes LLC, the electronic health records software I use. The therapy program and your treatment plan document will be embedded as a part of your progress notes that I complete after each session. The treatment plan and progress note are built in templates that are part of the software. If this isn't making sense, let me know if you would like me to provide you with a demonstration during your session. The treatment plan we develop will be a dynamic form and living document, evolving as you progress through therapy. Now let's talk about the long-term goals and short-term objectives. Together, we will choose specific goals and interventions that align with your unique situation. We will use evidence-based practices, mindfulness techniques, and holistic approaches to help you achieve your goals. Regular review and adjustment of your plan ensure that it remains relevant and effective throughout your therapy journey. The electronic treatment plan and progress notes in Therapy Notes LLC are what you and third parties will see when you request your records or they submit a records request. Third parties who might request this information include state regulation boards, insurance companies, and some courts. Please refer to the therapy agreement to review the limits of confidentiality and when I am legally obligated to breach it. I also recommend you open the therapy program treatment plan document and simultaneously follow along while watching this series of videos. My therapy program is based on a set of long-term goals that aim to reduce the frequency, duration, and severity of your symptoms and unwanted behaviors and improve your overall quality of life. All the goals, assessments, objectives, and interventions are determined by your unique needs and circumstances. We will work together to determine your needs and goals. Most of the processes in this program might not apply to you, so they will not be applicable and we can skip over them. The goals are also about achieving a deeper sense of satisfaction and functioning across all areas of your life. Whether it's family dynamics, daily activities, relationships, work, finances, or personal health. My aim is to help you function efficiently and feel more fulfilled. The long-term goals of an integrative and holistic model of therapy are designed to address the multifaceted nature of your health and wellness, considering not just the mental health aspects, but also the broader context of the activities of your daily life. Relationships, physical health, and your overall satisfaction with the many areas of your life. These goals are grounded in a comprehensive approach that aims to foster sustainable change and enhance your quality of life across various domains. One of the primary objectives is to decrease the frequency and duration of your reported and observed symptoms, behaviors, and problems to the point where your daily activities of living are no longer significantly impaired. This involves not only reducing the immediate effects of these issues, but also addressing their underlying causes to prevent them from recurring. By lessening the severity and impact of these symptoms, you will be able to engage more fully in your life without being hindered by your mental health challenges. Another critical goal is to lower your self-reported subjective units of distress rating on a 0 to 10 scale, which reflects your perceived level of distress in response to various situations. By improving this rating, therapy aims to help you feel more in control of your responses to emotions and experiences. Additionally, improving your overall satisfaction across various health, wellness, and life domains is essential. This might include areas such as physical health, relationships, work, and social involvement. The goal is for you to report higher levels of contentment and fulfillment in these areas, contributing to a greater sense of overall well-being. Increasing the level of functioning in your daily activities is another key objective. This includes helping you achieve an acceptable level of satisfaction and functioning in areas such as decision-making, problem-solving, quality sleep, daily living activities, household chores and responsibilities, and personal hygiene. Ensuring that you can manage these tasks effectively is crucial for maintaining independence and a sense of self-efficacy. Important relationships, whether they are intimate, romantic, sexual, occupational, or community-based, all play a significant role in your mental health. A long-term goal of therapy is to help you achieve satisfactory levels of intimacy, structure, and balance in these relationships. By developing healthier interpersonal dynamics, you can alleviate symptoms and reduce the likelihood of a relapse of symptoms and behaviors, because supportive relationships are known to be a protective factor against mental health challenges. Therapy also focuses on resolving the core conflicts that may be the source of symptoms, memories, nightmares, and resulting behaviors. By addressing these underlying issues, you can experience a reduction in symptoms and an improvement in overall functioning. Moreover, enhancing your ability to cope effectively with life's problems, stressors, worries, and anxieties is a central goal. This includes learning and implementing coping skills that can help you effectively manage the symptoms, behaviors, and problems you experience. A significant focus of therapy is on helping you develop positive actions aligned with your values, healthy life narrative schemas, wisdom, and logical and rational thinking patterns, and beliefs about yourself, other people, and the world around you. These cognitive shifts are critical in alleviating symptoms and preventing relapse. By fostering more adaptive ways of thinking, you can reduce the risk of returning to previous, less effective coping mechanisms. Appropriate grief processing is another important goal. I will support you in grieving your losses to normalize your mood and affective expression and achieve an adaptive level of functioning. If you have ADHD, diagnosed or undiagnosed, this program aims to improve your motivation and discipline, reduce emotional sensitivity and irritability, reduce impulsive actions while increasing your ability to concentrate and focus on low-interest activities, thereby minimizing behavioral interference in your daily life. For other attention deficits and executive functioning challenges, a crucial goal is for you to accept that these may be chronic neurological conditions that could require ongoing treatment, including medication. The program with therapy aims to help you sustain discipline, motivation, attention, and concentration for consistently longer periods, enhancing your ability to function effectively in various aspects of your daily life. Finally, the overarching goal is for you to achieve a satisfactory level of balance, structure, and intimacy in your personal life. This involves integrating the various aspects of your life into a cohesive whole that supports your well-being and allows you to thrive and flourish so that you can experience a fulfilling, meaningful, and purposeful and balanced life that is worth living. One of the primary objectives is to resolve core conflicts that may be contributing to your symptoms. By addressing these deep-seated issues, we can work together to alleviate your distressing symptoms, such as memories, nightmares, and unwanted or problematic behaviors. This process will enhance your ability to cope with life's challenges, develop healthier thought patterns, and prevent relapse of symptoms and behaviors. For unresolved grief, trauma, or adverse childhood experiences, I offer specialized support. I understand that these experiences can deeply impact your life, and my program is designed to help you process these experiences in a healthy way. I focus on helping you develop coping mechanisms, reduce emotional pain, and ultimately help you find peace and inner strength as you go through your healing process. The long-term goals of therapy for individuals dealing with childhood trauma are centered around fostering healing, developing self-awareness, and enhancing overall well-being. The journey through therapy for childhood trauma is multifaceted, focusing on the deep-rooted impacts of adverse experiences and working toward a life less burdened by past pain and suffering. One of the goals is to help you develop a deep awareness of how your adverse childhood experiences continue to affect your life. This involves understanding the lasting impact of developmental and genetic factors, as well as recognizing how significant events and life experiences from childhood shape your present experiences, sensations, thoughts, emotions, behaviors, and relationships. By gaining insight into how your past experiences and relationships influence your recent experience and current moment, you can start to identify patterns that may be hindering your personal growth and relationship satisfaction. Furthermore, another goal is to help you see the interconnectedness of genetics, experiences, relationships, and significant life events, and how these factors collectively impact various domains of your life in the here and now. This holistic understanding is crucial for beginning the process of healing and transformation. Resolving the issues stemming from childhood trauma is central to reducing the emotional and physical symptoms that often accompany it. In therapy, we work toward lessening your feelings of shame, guilt, frustration, anger, anxiety, overwhelm, fear, grief, and depression. Alongside these emotional challenges, the goal is to alleviate physical symptoms such as nightmares, headaches, panic symptoms, fatigue, pain, lethargy, digestive issues, hypervigilance, and emotional reactivity. As these symptoms decrease, you will be encouraged to cultivate more positive emotional states and behaviors, including consideration, cooperation, confidence, courage, compassion, calm, clarity, connection, curiosity, and creativity. The therapy process also supports the development of authenticity, patience, presence, awareness, humility, modesty, and playfulness, qualities that foster a more fulfilling and balanced life. Another significant goal of therapy for childhood trauma is to help you achieve a sense of safety, security, inner peace, serenity, and self-compassion. This involves the unburdening of past pain and suffering, leading to a reduction in feelings of terror, regret, contempt, and resentment. By addressing and releasing inner feelings of resentment, contempt, blame, criticism, rejection, neglect, and loneliness, you can move toward a more harmonious and compassionate relationship with yourself. We will work together to resolve your deeper feelings of worthlessness, hopelessness, helplessness, and powerlessness that may have developed as a result of childhood trauma. By working through these emotions, you can begin to reclaim your sense of agency and self-worth. Another essential goal is to eliminate or reduce the negative impact that trauma and stress-related symptoms may have on your daily functioning abilities. Through reprocessing the traumatic events and healing the associated pain and suffering, you can achieve an optimal level of psychological functioning. This includes no longer experiencing intrusive recollections or memories of the traumatic and stressful events, and no longer avoiding situations or people that trigger emotional reactions to these memories. Moreover, the goal is for you to no longer experience intense arousal when encountering a trigger, recollection, or memory, and to regain interest in activities or relationships that may have been avoided due to trauma. You hopefully will be able to think about or openly discuss the traumatic events without experiencing social, physical, mental, or emotional distress, signaling significant progress in your healing journey. An integral part of therapy will involve educating you about the effects of childhood trauma on both physical and mental health. Understanding the symptoms and behaviors associated with trauma responses can empower you to recognize these patterns in yourself. The work in therapy will focus on addressing these symptoms and behaviors by teaching you coping skills, stress reduction techniques, relaxation methods, and mindfulness practices. These tools can help reduce the frequency, intensity, and duration of problem behaviors, ensuring that daily functioning is not negatively impacted. Therapy can also help you release the intense emotions associated with past childhood and family issues. This release is aimed at reducing resentment and fostering a sense of serenity. Additionally, you will learn how to let go of blame and begin the process of forgiving those who caused the pain in your childhood. The process of forgiveness is not about freeing the perpetrators from guilt. The process is also not about excusing harmful behavior, but rather about freeing yourself, so you can be unburdened from the emotional hold the past has on you, thus allowing you to move forward in life with greater peace and less emotional burdens. The long-term goals of therapy for childhood trauma are comprehensive and transformative. Please allow me to provide a quick reassurance that if you believe the experience was traumatic, then the experience was traumatic. Everyone responds to life events differently based on many factors that are outside the scope of this one video. The goals of the treatment plan encompass developing awareness and understanding, resolving past issues, reducing negative symptoms, achieving inner peace, enhancing daily functioning, psychoeducation on trauma and healing, and helping you release emotions and foster forgiveness. Through this integrative and holistic process, you will be supported in your journey toward healing, allowing you to lead a life that is less burdened by the past and more enriched by a sense of well-being, self-compassion, and fulfillment. My therapy program also includes specific approaches for individuals on the autism spectrum. As a self-identified person on the neurodivergent spectrum, I recognize the unique challenges faced by those with autism. My approach is guided by the latest community advances in the support of people with autism, personalized to respect your preferences, strengths, and challenges. We will work on improving your communication skills, helping you understand social cues, and enhancing your ability to perform daily activities independently with minimal support. The goal is to support you in developing a strong sense of self, building confidence, and navigating social settings more effectively. For intimate relationship conflicts or family issues, my program provides targeted interventions to help you improve communication and resolve conflicts. We will work together to rebuild healthy, supportive relationships, whether these challenges involve romantic partners, family dynamics, or parenting. The aim is to create a harmonious environment where all members of your family or relationship feel supported and understood. Sleep disturbance is a key area we will address in this program. Restoring normal sleep patterns is essential for your overall well-being, and we will implement sleep hygiene practices and other strategies to help you achieve a restful sleep, restoring normal circadian rhythms. If you're struggling with substance use, I will provide comprehensive support to help you achieve and maintain abstinence Learn how to use medication as prescribed, or use substances in moderation and temperance. I will provide detailed and thorough educational materials on the short-term and long-term effects of each of the many different substances you might be using, including legal and socially acceptable substances like alcohol, marijuana, tobacco, nicotine, analgesics, opioids, supplements, caffeinated products, and steroids. We will work together to create a recovery plan that supports your vocational, social, physical, mental, spiritual, and emotional health and wellness. The work we do together will lay the foundation for long-term recovery and health and wellness. I will provide ways for you to learn how to become a critical thinker and how to take an unbiased look at the dangers of long-term substance use, the risks and benefits of nutritional supplements, and the risks and benefits of medications. Emotional dysregulation, anger management, and low self-esteem are common issues that we can tackle with this program. We will work on enhancing your ability to regulate emotions, manage anger, and build a positive self-image. This involves learning skills to recognize and manage intense emotions, communicate assertively, and develop a healthier relationship with yourself and others. By building resilience and self-worth, we aim to help you navigate life's challenges more effectively. Work and financial stress are significant contributors to mental health challenges, and our program includes strategies to address these areas. We will work on stress management techniques, improving job satisfaction, and developing financial literacy. Together, we will explore the underlying beliefs and behaviors that may be contributing to your stress, helping you build a more stable and satisfying life. In summary, the long-term goals and short-term objectives of an integrative and holistic model of therapy are designed to support you in the work of reducing your symptoms, improving your daily functioning, improving your satisfaction with your life, enhancing your relationships, resolving core conflicts, developing effective coping skills, preventing relapse, and achieving a balanced and fulfilling life. By addressing these areas comprehensively, therapy aims to foster sustainable change and promote overall well-being. That concludes this first video about my program. In the next video, I'll review the consultation, intake, and screening process of becoming a client. Much information will be discussed about compliance, regulations, paperwork, and documentation.